Hello, lovelies. Hi, I'm Dr. Lisa Mateka. I help those with cancer navigate their inner journey towards health and wellness on all levels, physically, emotionally, mentally, energetically, spiritually, to stack the odds in their favor and self-realize wholeness so they don't have to suffer and figure it out alone. And today I'm going to focus on a physical component of health. So this is going to be much different than last week's video. Shorter, simpler, I guess to the point. And sometimes you can expect videos from me like last week where we do a deeper dive into like life coachy, self-development, self-empowerment, touching on those emotional, mental aspects. And then sometimes I'll stick to the science and do some physical guidelines for health. And sometimes I'll even dive into the more spiritual, esoteric stuff. And sometimes I'll bridge science and spirituality, which is very fun. And more. So expect variety from me. Not only is it the spice of life, but when it comes to cancer, something as complex as cancer, it just deserves and demands a multifaceted, multi-dimensional approach. So with that being said, today we're going to focus on the physical. We have a formula, 0, 5, 10, 30, 150. What does it mean? Well, before I reveal that, just a little introduction disclaimer here. So this formula was created based on 10 major studies, and it was actually made as a prevention formula, not only to prevent cancer, but also heart disease, stroke, and diabetes. Now, just because it's made as a prevention formula doesn't mean it has no use if you've already been diagnosed with cancer. I would actually argue that it's absolutely essential if you've been diagnosed. I see it sort of as a bare minimum of what you should be doing with your health. A strong foundation, a perfect stepping stone, starting place. In naturopathic terms, this will strengthen the foundations of health and remove obstacles to cure. So look at it that way more than like a cure in and of itself. These are just some lifestyle changes that are going to be pivotal for paving the way towards health. So, all right, I guess let's dive right in. 0. This refers to zero tobacco products. Zero smoking, zero cigarettes, vaping, chewing tobacco. Now, when it comes to nicotine gum or patches, I would say that is okay if it is moving you towards weaning yourself off of tobacco products. Now, some people are just using them to get extra nicotine, and that's not good. But if you're using it to get off of nicotine, then yes, that is fine. I'm not going to get too much into the how with these, but I will mention a couple things so they can be helpful and perhaps practical for you. So quitting smoking and all of that we know is very difficult. It helps to have some emotional leverage and to make it part of your identity. But as far as strategies, so hypnosis has lots of success stories. If you can find a hypnotherapist in your area, hypnosis works, NLP, neuro-linguistic programming. Also the Thera Wellness device. If you could Google that, find someone in your area, there are some smoking cessation programs. It's basically a biofield therapy device, and it really does work. So just a couple of things there. Then we have 5 servings of fruits and vegetables daily. Now, for some of you, you're already doing it. So I would say up the ante, make it organic, make it non-GMO, make it raw and fresh. And for some of you, 5 servings of fruits and vegetables daily sounds like a lot. It's really easy to get in. If you get yourself a good blender or a good juicer, I like making smoothies because I kind of like keeping the fiber in, but juices have their own benefit for cancer for sure. But with this, 5 fruits, vegetables, you can easily make one big smoothie to last you throughout the day. You can sneak vegetables in there so you don't taste them with all the fruits. Things like kale, greens, carrots, even beets. But there are savory smoothies too. People don't really think about this. But if you like V8 and things like that, you can make savory smoothies. They're delicious. Otherwise, find fun ways to prepare vegetables. Get a cookbook. Different ways of not only cooking them, but even preparing them raw, marinades. Find something that works for you. There's definitely ways to enjoy eating 5 servings of fruits and vegetables daily. So this number came from a study, the Atherosclerosis Risk in Communities study, and I want to mention it because it's a really cool study, because what they found was it was this 5 servings that had the same benefit as the Mediterranean diet. which is so cool because the Mediterranean diet is the most well-studied diet for cancer. And if you can get the same benefits or similar benefits from just 5 servings of fruits and vegetables daily, then that's awesome. So the Mediterranean diet is like an anti-inflammatory diet. It's, again, with diets, I just want to say there's not like one size fits all diets for people with cancer. It is the most well studied. It doesn't necessarily mean it's the best, but it does mean there is the most evidence and validation for it, and it is a good one. So 5 servings of fruits and vegetables, 0 tobacco products. Now we're up to 10. 10 minutes daily of meditation or mindfulness, relaxation, silence, prayer. All that counts as well. Now this was made for stress reduction. This was specifically in this formula for stress reduction because stress management is extremely important in cancer. But we know it has other benefits as well. I mean, just sort of getting out of your head gets you out of the fears, the doubts, and into that deeper, wiser part of yourself. But yeah, if you're already doing 10 minutes, again, up the ante. 15 and 20 is better than 10. If you're not there yet, start at 10. And there's many different ways to meditate. A good beginner way is to do some guided meditations, listen to some relaxing music, some binaural beats. Just focus on your breathing. You can stare at a candle. And I just have to say, the goal of meditation, a lot of people give up because they think the goal is to not have thoughts. You're going to have thoughts. It's okay. The goal is not to not have thoughts. The goal is to not process the thoughts. The goal is to not follow those thoughts and get lost in those thoughts. It's to be like, okay, there's a thought, and then practice letting that thought go, like clouds passing over a sky. So I'll have to have a whole another video on meditation. It's a big subject. But yes, 10 minutes of meditation or silence prayer daily, 5 servings fruits and vegetables, 0 tobacco products. Now we're on to 30. BMI less than 30. So we know that obesity lends a very hospitable environment to cancer. It holds on to toxins, creates inflammation, dysregulates hormones, among other things. Now, if your BMI is 30 or over, this isn't something you're going to be able to achieve overnight. But as long as you're working towards it, work towards this number, it's going to be good for your health on all levels. So of course, there's the tried and true method of eating less, moving more. There's other things that are helpful as well. Again, I want to mention the Thera Wellness device. They have a whole weight loss program with using the biofield therapy along with a diet and some supplements. Sometimes people just need a little extra help. I would also look into Zenith supplement. Now, normally I would never condone a supplement for weight loss, but this is different. This is a new sort of thing. It works on leptin modulation, which is a hormone involved with fat metabolism and hunger. Isogenics company, they have their studies, a few studies on using their products with carbohydrate restriction and intermittent fasting and having success with weight loss. So there is help out there. So BMI less than 30, 10 minutes of meditation, mindfulness, prayer, silence a day, 5 servings fresh fruits and vegetables. Well, I guess they don't have to be fresh. Servings of fruits and vegetables, 0 tobacco products. Now we're up to 150. What could 150 be? 150 minutes of exercise per week. Okay, this isn't a lot. This is 30 minutes, 5 days a week. This is 21 minutes a day. And there's many different guidelines for exercise. This one specifically came from these studies and was adapted by the U.S. Department of Health and Human Services Physical Activity Guidelines for Americans. And it's a pretty good one, but again, more is better. Now this means at least brisk walking, not a leisurely walk, at least brisk walking. And find an exercise that's fun for you. If you don't like the gym, well, some people don't like the gym because they don't know what to do. If you get a personal trainer, they can help you figure out what to do in the gym. Otherwise, there's a lot of things to do outside. Hiking, jogging, cycling, mountain biking, rollerblading. You could go dancing, join a sport. There's some sports you don't have to necessarily join a team, like driving, the golfing, driving, batting, racquetball. There's all sorts of stuff. Paddle boating, rowing, yoga classes, Pilates. There's all kinds of classes like that, kickboxing, martial arts. Find something fun. Find something that works for you. But even cancer patients undergoing chemo are recommended to walk daily. It really does help. So 150 minutes of exercise per week, BMI less than 30, 10 minutes of meditation, mindfulness daily, 5 servings fruits and vegetables, and 0 tobacco products. That is a great place to start. I would say a bare minimum for someone who is dealing with a cancer diagnosis. And yeah, just a little quick video. Hope that helps. If you found it helpful or think somebody else might find it helpful, again, share, like, subscribe, leave a comment, because my goal is not for myself to get big, but to share these messages and to share this information so that others can be helped. All right, thanks everybody.